Okay, we have 35 blocks to go, so you have plenty of time to answer a bunch of questions. Ready for the first one?
Yeah.
First question for $100. What physical data should the nurse acquire about this patient prior to the administration of tenormin or atenolol?
You know this one?
I think that you're supposed to get the blood pressure and the apical pulse before you give a patient atenolol, which is a beta blocker, because it has negative inotropic and chronotropic effects. What do y'all think?
I think that's right.
I believe you're correct.
Yay!
Okay, next question for $200. What lab values are needed when administering vancomycin?
Aren't you supposed to draw a peak and trough?
Yeah, I think so.
I think
yeah.
That's right.
Yay!
Next question for $200. This patient is being given vancomycin. What lab should be monitored to detect nephrotoxicity?
You know what? I think it's the BUN, the creatinine, and the creatinine clearance to, evaluate the kidney function, right?
Yeah, right. I think so.
You're right.
Yay!
Woo-hoo. Next question for $200. This patient is receiving a potassium supplement. What signs and symptoms would indicate hyperkalemia?
I think it's fatigue, weakness, paresthesias, paralysis, and they're going to also have EKG changes like peak T waves, short QT intervals, and ST depressions. Right?
You're correct.
Yay!
Next question for $200. Grieving the loss of health and normalcy is a part of living with Alzheimer's and dementia. Name the 5 stages of grief.
Ooh, I know this one. According to Elizabeth Kubler-Ross, the stages are denial, anger, bargaining, depression, and then acceptance.
Yes, that's correct! Question for $200. Because of the 24-hour care involved with this patient, what is a priority psychosocial consideration?
I think you have to be aware of caregiver role strain.
That is correct!
Yay!
This next question is worth $200. What are some ways a family can get support for their patient and themselves?
Well, there is always, family education. There are people that do case management, online and social support groups, as well as respite care.
You're correct!
Yay!
Here's a question for $200. What cultural considerations would a nurse give to a lifelong Baptist on hospice care?
Well, I think you definitely need to provide opportunity and resources for in-room Sunday services and prayer. And definitely make sure there's a Baptist priest present at the time of death.
You're right.
Woo!
Okay, for this question, $200. How would you care for this patient's submandibular abscess?
Okay, well, I would refer for an ST consult and perform mouth care twice a shift with lemon or glycerin swabs and monitor for decreased appetite and aspiration.
Very good.
Yay!
Yay!
Okay, for $200. What would we remember to document on this patient?
For documentation purposes, you would document the type of wound, the staging, correct anatomical location, the measurements, presence of tunneling or undermining, drainage, the amount, color, consistency, and or odor, slough, eschar, granulation, or epithelialization, wound edges, if they're curled, calloused, macerated, or detached, and the presence of infection and what causes you to believe it is infected.
Yeah.
Very good. That is correct.
Yay!
Woo-hoo. This next question is worth $200. In your opinion, which of Erickson's stages of development would fit a patient like this with a diagnosis of dementia?
Man, I don't know.
I don't know. That's a hard one.
What are we gonna do?
Friend?
Can we phone a friend?
Yeah, let's phone Likia.
Yeah, she's really
Perfect.
smart.
Okay, I've got her number. Ring, ring, ring.
Hola.
Hola. Hey, Likia, it's Kendra. We're in the clinical cash cab playing for money. Can you help us answer a question?
Yes, I can.
All right. Do you remember Stephanie's patient from Grand Rounds?
Yes, I remember.
What stage, of Erickson's stages of development would you put her in?
Well, it's difficult to put this patient on Erickson's developmental stage because she has dementia. And remember that Erickson theory is based on memory, reflections, and social interactions. And this patient cannot even speak. So it's hard to put her on despair. But as a nurse, point of view and your objective data, it's possible to treat her as a patient in despair because her declining health status.
I
What
don't
do you
know.
think?
That
Sounds good to me, yeah.
Yeah.
What is the answer?
Well, if that's your opinion, it's absolutely correct. Okay, next question for $200. Tell me one nursing diagnosis for a person with sepsis.
I think I know this one.
Okay.
Infection related to tissue destruction.
That's right.
Yeah! Yay!
All right, this question's $200 again. How would you care for this patient's stage 3 pressure ulcer?
Oh, I know. You would clean with normal saline and dry and apply a zinc oxide ointment to the wound, turning every 2 hours, and make sure that you have incontinence management, keeping the area and surrounding area clean and dry.
Definitely.
Yes.
You're right.
Yay!
All right, another question, $200. What other interventions would you also include for this patient regarding wound care?
Oh, some other interventions that will help to be preventative and not compound the issue would be elevating the head of bed no more than 30 degrees, maintaining hydration, using an air mattress, and monitoring the patient's nutrition status, especially vitamin C, in order to heal.
Absolutely correct. Here we go, $200. What are additional measures to advise this patient regarding pressure ulcer prevention?
Okay, teach the use of pillows, foam wedges, and pressure reducing devices to prevent further complications or developing any new pressure ulcers.
Yeah.
That's
Very
good.
good. Very good.
Yeah. Good job.
Next question for $200. What discharge teaching would you give this patient?
I know this one. You would teach the caregiver to continue oral care as prescribed with lemon or glycerin swabs, maintain cleanliness and using hand washing while caring for the wound, teaching the signs and symptoms of infection, as well as when the dressing needs to be changed.
Yeah, that sounds good.
Incredible answer! All right, we've arrived at a red light, so that triggers a red light challenge! Based on the information you've received regarding this patient, what healthcare team members do you think should be involved in the care of this patient?
Maybe radiology?
Pharmacy,
Laboratory.
Respiratory therapy.
wound care,
Dietary.
Speech therapy.
Nursing staff?
PTOT.
Case management.
Hospice.
I think that's
I
it.
think that's it.
I think you covered it. You guys did great!